looked into the evidence behind the passive and active smoking of tobacco, cigarette smoking, shisha, and hookah, which is also prevalent in certain other countries. This is Dr. Shuruk Hashmi. I'm a consultant at the Sheikh Shakbout Medical City Mayo Clinic Abu Dhabi, as well as a supplementary consultant at Mayo Clinic in Rochester, Minnesota. And I am an oncologist, as well as a public health preventive medicine expert. Today I'm going to talk about an article that was recently accepted at the Mayo Clinic Proceedings that was written by myself, my colleagues, Dr. Fazl Hussain, as well as Dr. Taylor Hayes, on the impact of smoking on the COVID-19 outcomes. The title of the article is "Thank You for Not Smoking," and should be out in print very soon. We looked into the actual severity of illness based on the smoking, and we did find that the smokers had much worse outcomes compared to non-smokers if they contracted COVID-19 infection. For example, in one study from China, the proportion of people who were admitted to the ICU, were on ventilators, or had death, 25% of them were smokers, which is a huge number. Now, this indicates that the severity in the smokers may be very, very high. And we have data from decades of research indicating that the smokers, especially tobacco inhalers, will have a lot of lung inflammation and inflammation of the upper respiratory tract. And that can lead to significantly worse outcomes. And quite often, when they contract COVID-19, they can end up in either being hospitalized or in the ICU. One of the areas that we need to focus on is curtailing active and passive smoking both. We have a lot of efforts in talking to individuals about tobacco cessation, but the secondary smoking, passive smoking, also causes significant injury to the lungs and the respiratory tract, causing severe illnesses in the viral infections. Thereby, tobacco forms, for example, shisha, which are very prevalent in some developing countries. Within the United States, this prevalence is increasing, unfortunately, but outside the United States, especially in the Europe and Middle Eastern countries, shisha smoking is a social event. So generally, the people are smoking all night, sometimes on the weekends. And there's a lot of active and passive inhalation of smoke during that time, and that also increases the risk of COVID-19 infection transmission. There's a lot of factors we can't control, and we have to wait for vaccine for the COVID-19, which is going to take some time to have an effective vaccine and be delivered to get a herd immunity. But until that, our efforts in innovation for medications that can treat COVID-19 effectively, as well as our efforts to have preventative strategies, should be maximized. And cutting down on smoking is one strategy that can tremendously affect the people at population levels. Fortunately, the World Health Organization has devised many programs to curtail smoking all over the world. However, that is not enough. We strongly call upon the World Health Organization to work with the local governments, as well as with the World Trade Organization, to help us in curtail the smoking prevalence and smoking sales throughout the world. And this is a method that can be very, very cost effective. It requires not a significant investment, financial or monetary, but it really requires a culture change. Thereby, I would strongly encourage all of you to take a look at the article that we published in Mayo Clinic Proceedings and look at the actual data that we have accumulated in that manuscript, and think carefully that how can we help at an individualized level, at a population level, and at a policy level because at the end of the day, the whole purpose is less suffering. And that ain't going to happen until we actually combine our efforts of public health against smoking and various forms of tobacco. With that, I'm going to thank you for listening to me, and I hope you get a chance to read the article. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.